Hello, I'm Maxwell Synsvoll at Synsvoll Chiropractic in Battleground, Washington. If you're watching this video, you're watching it because either you or a loved one is currently suffering from a thyroid disorder, Hashimoto's disease, chronic fatigue troubles of some sort. This video is designed to teach you what makes us different in helping this particular type of condition. We are different in several different ways. We use both metabolic and neurological testing along with the treatments that we do here in this office. Metabolic treatments are based on specific lab panels. With someone who has a thyroid disorder who may be on thyroid medication already and they're told that they're on the medication and that should take care of the problem, but they still don't feel well. We do specific thyroid panels, a complete metabolic panel, lipid panels, a CBC chemistry with auto differential. We do a very broad spectrum blood testing. We also do a hair analysis so that we can assess your entire body, thyroid, the adrenal glands, the liver, and see how they're functioning. Now, we're not treating these in the same way that your medical doctor may by placing you on medications. This is a natural approach. Based upon these tests, when we get them back, we place people on a specific program designed exactly for them. This is not a cookie cutter approach. We look at the kidneys, the red cells, the white cells, how the gut is functioning. We do specific sensitivity testing as well, because sometimes there's certain things that you're putting into your body which are making you sick. So we want to make sure that we look for the specific ones that are doing that and then get them out of your body. Here are some of the symptoms of these sensitivities. Chronic pain or fatigue, frequent indigestion, being bloated after eating, frequent loose bowel movements, constipation, mouth ulcers or sores, vomiting often. The only way to find out if you're suffering from any of the sensitivities is to run a test. Many people who have thyroid disorders are also stressed in their adrenal glands as well. So we do a specific adrenal stress index. Now, we may do some of these, we may do all of these depending upon your condition. That's why I need to sit down and talk with people beforehand to see exactly what's going on with you. Take a look at all of the blood tests, all of the testing that you've had done prior to coming to us, and then based upon that, I know what's necessary for the next step. If you suffer from insomnia, blood sugar issues, we need to measure your cortisol levels and see how that's working in your body. We do specific immune panels. Your condition could be caused by an autoimmune disorder. As you know, an autoimmune disorder is where your immune system attacks a particular area of the body. Your nervous system, joints, connective tissue, your thyroid. So we test for any specific antibodies to determine if you suffer from an autoimmune condition. We do specific immune panels, which you can see listed here. Interleukin-2, alpha, Th1, interleukin-4, interleukin-10. And again, it depends upon the condition that you have as to what's necessary for the testing. But again, we do a broad spectrum testing. Our goal is to get you healthy. So when we look at all of the tests that we do, it's to find out if you're in a healthy range or not. And if you're not in a healthy range, how do we get you back into a healthy range? You'll want to determine if there's an antigen or dysregulation. What does that mean? Sometimes you can have a parasite in your body that may be making you sick. That can be bacteria, viruses, mold, yeast, fungi, protozoa, foods, chemicals, heavy metals. Thinking of a few patients right now that we're working with and getting fabulous results as we get the heavy metals out of their system. We may look at the neurotransmitter profile in your body, hormone panels, see if your hormones are working appropriately. Look for any inflammation that's going on. We do sometimes use glutathione in our treatment. Glutathione is the mother of all antioxidants. It reduces inflammation throughout your entire body. It is one of the factors that the Academy of Anti-Aging Medicine looks at to see how old a person is biochemically. Then based upon what we find, we may do some of these things. Oxygen therapy. Your brain needs two things to work. It needs fuel in the form of oxygen or glucose. And then it needs activation. And activation is in the form of your body moving appropriately. 80%, according to the studies, show that 80% of the movement comes from our spine. So if your nervous system is not moving appropriately, then your brain's not going to be functioning appropriately and you may have a lot of pain. We do brain-based therapy, which could be a simple vibration therapy, caloric stimulation, which just works with your ears. All these are very gentle things. Laser therapy, we use a specific type of laser to help decrease inflammation in the body. We may do non-surgical spinal decompression. We also use an interactive metronome, which is a computer-based program that uses visual, auditory, motor stimulation to increase the firing of your brain in certain areas. So once we've run the necessary tests to determine your specific condition, we can successfully treat you via proper neurological and natural nutritional protocols. So ask yourself the following questions. How has your chronic condition affected your job, your relationships? Do you have any left? Your finances. Do you have any money left because of the problems you have? Your family. Are you able to get out and be as active as you want to? What has it cost you in time, money, happiness, or sleep? Where do you picture yourself in the next 1 to 3 years if your condition is not taken care of soon? And what is it worth to you if we could improve your condition? If you're watching this and you'd like to get some help for this, contact our office at the number that's listed on here and we'll offer you a free consultation. Thank you.